Well, good afternoon, everyone. Thank you for joining us. Dr. Ezike and I wanted to provide an update on the COVID-19 medical matters and also our vaccine distribution process throughout the state. So let's dive in. Late last Friday, the FDA authorized the Moderna COVID-19 vaccine for public use. This is a wonderful development, but it may create some confusion among the public. For both of these vaccines, you are required to get 2 doses. But it's important to remember that experts say you should not mix vaccines. So whichever one you eventually get for your first dose when it's available, Pfizer or Moderna, that's the one you should stick with for your second dose. Your healthcare provider will keep track of this for you, and you'll also receive a card to take home to remind you after you receive your first dose. Our own Illinois Independent Review Panel has now evaluated all available FDA findings for Moderna's vaccine, just as they did for Pfizer's. And once again, the experts in Illinois unanimously endorsed the CDC's recommendations on the vaccine. Also, over the weekend, the CDC's Advisory Committee on Immunization Practices, ACIP, met to provide further guidance on upcoming rounds of vaccinations, which states can then use to guide their own prioritization orders. Remember, we're still in phase 1A, defined by ACIP as healthcare workers and long-term care facility residents and staff. And it will take some time before those vaccinations are completed. The new recommendations from ACIP offer suggestions for the next rounds, phase 1B and phase 1C. Our IDPH team is reviewing ACIP's recommendations in the context of Illinois' data, and Dr. Ezike and I will provide a further update in the new year on what the coming phases will look like in Illinois. In the meantime, Illinois, including the city of Chicago, has, as of last night, administered 100,991 vaccine doses to date. That's more than any other state in the nation so far. That's a product of the hard work and deliberate process of Illinois' IDPH and IEMA vaccine distribution team, our state's local public health departments, the Illinois Health and Hospital Association, and the amazing staff on the ground maximizing efficiency and minimizing waste. Their success is a win for all of us. By sheer population, California is 3 times our size and Texas is 2.5 times our size, so they will eventually outpace us in sheer numbers at some point this week. But the vaccine team in Illinois sprinted past them all in week 1. This week's allocations from the federal government include 23,400 Pfizer doses outside of the city of Chicago, 15,600 Pfizer doses to the city of Chicago, and another 37,050 Pfizer doses from our allocation set aside for the federal government's long-term care vaccination program outside of Chicago, operated by CVS and Walgreens. The majority of those shipments were shipped directly to locations around the state yesterday, with the final shipments arriving today. This week also marks the beginning of Moderna shipments here and across the nation. Today and tomorrow, 174,600 Moderna doses will arrive direct to providers and local health departments across the state, with Chicago expecting approximately 48,000 doses this week on its own. The Moderna vaccine, of course, does not require ultra-cold freezer storage and has a longer shelf life of 30 days if kept refrigerated after it's thawed, which allows for more flexibility in its distribution. And with this week's Moderna shipments, vaccine will have officially reached all 102 counties in Illinois. Next week's tentative allotment by the federal government is reasonably consistent with what we expect based upon the updated reduced allocations that I announced last week. And when we have final numbers on those expected shipments, I'll be sure to provide them to you. Our lives are full of so many unknowns right now, and our child care services know that all too well. I wanted to make sure today to make an announcement that I hope will provide some relief to our child care provider network and our working families this holiday season. So the challenges that child care services are seeing are staff calling in sick or staying home to take care of their own families, concerns about community transmission, families pulling their kids out of care. These tumultuous times have rained down in multiple ways upon our early childhood network of providers. And I wanted to make it easier for them so that we can make sure that childcare is available to parents who need it. So as we face down this pandemic during this winter, Illinois is going to step in and help all providers and families enrolled in our Child Care Assistance Program, otherwise known as CCAP, secure a little more stability and flexibility just as we did in the spring. The state will cover all eligible days of CCAP payments for December, January, and February, no matter what your attendance looks like. And all that's required is for providers to submit to us a simple waiver form. I want to commend the incredible staff at the Department of Human Services who have done such an amazing job managing our federal relief funds and our existing state dollars so that we can offer this additional winter support to providers and families without requiring any additional state dollars. Our team also stands ready to implement Illinois' portion of the $10 billion in child care support included in Congress's December stimulus package. Throughout the pandemic, I have called for more assistance for this critical sector, and I'm pleased to see the recognition of this need in this latest round of stimulus. The fastest way to the post-pandemic world our residents deserve comes when our national government invests in lifting up the schools, small businesses, and first responders who shape our communities. And I promise to continue fighting to get those dollars for our working families and for all residents of Illinois. So thank you. And with that, I'd like to turn it over to our Director of the Department of Public Health, Dr. Ngozi Ezike.
Thank you, Governor, and good afternoon, everyone. As we all know, this has been the year that no one dreamed of or asked for. Lives have been lost, businesses have been turned upside down, and our everyday norms have been interrupted. And hundreds of thousands of Illinoisans had their health deteriorate at the hands of a deadly virus. I want to thank the Illinoisans for taking this virus seriously, who's listened to public health guidance and practiced mitigation measures that saved many, many lives. It goes without saying that 2020 was the year of the essential worker. From the nurses and the doctors treating the COVID patients to the grocery and the factory workers that kept Illinois moving. I can't thank each of you enough. We are indebted to your service. And of course, some have lost their lives in doing so. To the teachers that adjusted to e-learning and the first responders that showed up to work every single day, risking their health in order to do their job, I thank you as well. To Team IDPH and all of our local health department partners, because of you, we have been able to educate and support and provide Illinois with the tools to help slow down the spread of this deadly virus. To Governor Pritzker, to Deputy Governor Sol Flores, and all of the state of Illinois agencies, I thank you for your steadfast leadership, your unwavering support, including the 4:45 a.m. text and the 11 p.m. conference calls. Illinois would not have been able to perform over 12 million tests, vaccinate over 100,000 frontline medical workers, putting us #1 in the country right now, and provide millions of dollars in grants to small businesses without our state leaders. Thank you. Today, we are reporting 6,762 new individuals diagnosed with COVID-19, or a total of over 918,000 cases in Illinois. And unfortunately, we have received notification of 135 new deaths in the last 24 hours for a total of over 15,500 lives lost. Overnight, 4,593 individuals were reported to be in the hospital with COVID, and of those, 953 were in the ICU and 536 were on ventilators. In the last 24 hours, 82,000 tests have been reported for a total of more than 12.6 million tests since the beginning of this pandemic. Yes, there is a long road to go, but we are truly at the beginning of the end. There's still road to cover, but we have to stay the course. We can't let people who've made it this far not make it to the finish line. We've gone too far to turn back now. The best way to avoid another surge in hospitalizations, another surge in deaths, another surge in new infections is to celebrate the holidays at home with the family that you currently live with. And I know it sounds crazy to ask that yet again, and I know that some of you will, and I know that some of you won't or can't. And for those of you, I ask you to think of additional safety measures that you can employ as you travel, as you gather, that can make the visits somewhat safer than the safest option. For those that are staying home, I know you have to reflect on this tough year. All of us are reflecting on this tough year, and we'll think about our loved ones, but we will make plans for next year, and we will hope for many of the people that are here today to still be with us as we get back to normal. Another quick reminder that even though more vaccines are being administered, we still have to mask up. We still have to wash up. We still have to back up and keep that 6 feet of distance. And it's not too late to get your flu shots. We are not in the peak of flu season yet. And so you can help our hospital workers by protecting yourself against the flu, protecting yourself from transmitting the flu to others, and preventing those flu hospital admissions for those healthcare workers that are overwhelmed already with all the hospital beds that are in use now. I wish everyone, again, a healthy and happy holidays, and look forward to a wonderfully bright 2021. And now I'll summarize comments in Spanish. Buenas tardes. Como todos sabemos, este ha sido el año que nadie pidió. Se han perdido vidas, negocios, nuestras rutinas se han cambiado y cientos de miles de gente en Illinois han tenido su salud afectada a manos de un virus mortal. Felicito a gente de Illinois que tomaron este virus en serio desde el principio. A los que escucharon las guías de salud pública y pusieron en práctica medidas de mitigación, han salvado muchas vidas. No hace falta decir que 2020 fue el año del trabajador esencial. Desde las enfermeras y los médicos que tratan a los pacientes con COVID, hasta los trabajadores de las tiendas y las fábricas que hicieron que Illinois siguiera adelante. No puedo agradecerlos lo suficiente a cada uno de ustedes. Estamos en deuda a su servicio. A los maestros que adaptaron al e-learning y a los primeros responderos que fueron a trabajar todos los días, arriesgando su salud para hacer su trabajo. Les agradezco. Al equipo IDPH y todos nuestros trabajadores de departamentos de salud locales, gracias. Gracias por educando, apoyando y trayendo a Illinois los recursos para ayudar a frenar la propagación de COVID-19. A gobernador Pritzker, gobernadora diputada Sol Flores y a todas las agencias del estado de Illinois, gracias por su firme liderazgo, su apoyo y los mensajes de texto a las 4 de la mañana y las conferencias telefónicas de medianoche. Illinois no habría podido realizar más de 12 millones de pruebas, distribuir más de 100,000 vacunas y proporcionar millones de dólares en subsidios a negocios sin nuestros líderes estatales. Gracias. Hoy informamos 6,762 personas recién diagnosticadas con COVID-19 para un total de más de 918,000 casos en Illinois. Desafortunadamente, anunció 135 nuevas muertes para un total de más de 15,500 vidas personas en Illinois. Durante la noche se informó que 4,593 personas estaban en el hospital con COVID-19. De ellos, 953 personas estaban en la unidad de cuidados intensivos y 536 personas estaban en ventiladores. En las últimas 24 horas se han reportado más de 82,000 pruebas para un total de más de 12,6 millones de pruebas en Illinois. Sí, queda un largo camino adelante. Estamos al principio del fin, pero debemos mantener el rumbo. La mejor manera de evitar otro aumento de gente en el hospital, otro aumento de gente que han muerto y nuevas infecciones es celebrar los días festivos en casa solo con la familia con la que vive. Quédate en casa y reflexiona sobre un año difícil con tu familia. Haz planes para el próximo año con los que todavía están con nosotros. Por último, un recuerdo para todos, aunque se están administrando más vacunas, todos debemos seguir usando máscara, lavando las manos, manteniendo nuestra distancia de 6 pies. Espero que tengan felices y saludables días festivos a todo Illinois. Muchísimas gracias. And with that, I'll turn it back over to Governor Pritzker.
All right, we'll start with some questions. Peter Hancock at Capital News, Illinois. The rolling average case positivity rate has been below 8% for 4 days. At what point will you allow bars and restaurants to reopen, even with limited seating?
Well, Peter, I just want to point out that, as you know, we've had metrics for the closures and capacity limits for bars and restaurants for some time now. And the challenge that we have is what we don't want to do is swing back and forth between mitigations and not having mitigations within days or a week or two of one another. And as we head into the into the Christmas holiday and New Year's, my concern is that we are likely to see some uptick from Christmas and from New Year's in hospitalizations as well as cases. So I'm concerned about that. Having said that, even if we brought the entire state or specific regions from Tier 3 to Tier 2, that would not open bars and restaurants for indoor service yet. We need to bring it down even further and for a longer period of time.
Dean Olson at the SJR. Please repeat the changes in child care reimbursements. You were garbled. There will also be a press release on that, Dean, going out from DHS. And how long will it take to get through all of the healthcare providers and long-term care residents and just frontline workers in 1A?
Well, let me start with the question on child care, and we can certainly get you the release on that. But I want to make sure. So we're basically making it much less expensive, near free, for any parents to get childcare services, and we're also making sure that reimbursement to childcare providers is streamlined. And so that's essentially what we've done, and we're basically trying to make childcare much easier during the winter than it has been even throughout the pandemic, where we've significantly increased funding for childcare and tried to keep as much childcare open as possible. To your other question, how long will it take to get through the healthcare providers and long-term care residents? Well, remember, there are approximately 700,000 healthcare workers that are covered in 1A. And that's, so you can, see we've done about 100,000 so far as of, what are we, a week and a half in now? And I'll add that about 110,000 nursing home residents plus staff. So it gives you an idea of how large that 1A category is. And then we would move on to 1B as soon as we could get through 1A. So we need to see what the shipments look like. As you saw, they were diminished by some amount over the last week, as I first reported to you middle of last week. And so it, the less that they're delivering to us, the less will be done within 1A before we can get to 1B.
Kelly Bauer at Block Club. Does Illinois have to follow ACIP's recommendations, or could it prioritize different groups in future vaccination phases, like people 65 and older instead of 75 and older?
Well, ACIP is a highly regarded group. They are, selectively chosen for that role. We think their recommendations are very important for us to pay attention to and likely to follow. There are some things that they are silent on within their recommendations, and so there are decisions that need to be made within those. And that's why, you'll see us after ACIP gives recommendations, you'll see what the Illinois implementation of that will look like.
Jamie Monks at the Tribune. With the latest CDC guidance that people over 75 and frontline workers outside of healthcare should be in line next to get vaccinated after phase 1A, is there an estimate for how many Illinoisans would fit into that next phase and how the state might prioritize them into subgroups?
I don't know the exact number. I know it's in the millions, or it's beyond a million. So maybe Dr. Ezike might have that number, and if she doesn't, we will try to get you an approximation. But it's quite a large number.
Okay. Dr. Ezike, did you have that number? Could we get it later?
We'll have to get that later. I don't have that at my fingertips.
Sure. Okay, we'll go to Cole at WCIA. For the governor, did members of the Illinois congressional delegation consult you during stimulus negotiations, especially when state and local aid was dropped from the bill?
I had a number of conversations with both of our senators and along the way with our Democratic House members. The Republican House members seem to have been opposed to many of the provisions that we wanted to see included. But I made sure that I was reaching out to our delegation, and they in turn were calling me. This mostly occurred, as you know, in the Senate. Nancy Pelosi, representing the House, was the negotiator, but there were internal negotiations going on between Republicans and Democrats in the Senate, and I know that Senator Durbin played an important role in the negotiation.
Michelle Gallardo at Channel 7. Monday, parents of 4 high school athletes filed a lawsuit against you and IHSA, claiming the cancellation of winter sports, challenging the cancellation of the winter sports season. My question is, why have high school sports and restrictions placed on them when college and pro sports haven't?
Oh, well, gosh, we talked about this some months ago when it first arose. Professional sports and college sports have significant resources for protecting their players, for creating social distance, for example, by having multiple locker rooms, by making sure that they've got plexiglass everywhere that they need to separate the players, to test them on a regular basis, a much more regular basis than an individual high school or a district could afford. And so that's why there's a difference between college and pro sports.
All right, 1 second. Lexi Cortez, question from the Bellevue News Democrat. Will long-term care residents have another opportunity to get vaccinated if they refuse the vaccine when CVS or Walgreens are in their building but later decide they want to be vaccinated?
Yes, of course they will, as will the members of the general public when it gets to, other phases of vaccine distribution. But as for now, I certainly want to encourage residents, their family members who are making decisions for them, and all the staff at those long-term care facilities to take advantage of the fact that those vaccines will be brought to them in their long-term care facility and made available to them nearly immediately over the next 4 to 8 weeks. And again, that's run by the federal government and their partnership with CVS and Walgreens. So I look forward to that moving as quickly as possible.
Bill Cameron at WLS Radio is asking about your reaction to Senator Durbin's comments that you shouldn't count on aid from Washington.
Well, I think he's certainly reacting to the fact that there are a number of Republicans who never will provide any, they won't vote for any state and local funding. That's not all Republicans. It seems to be about half of them. That half seems to include Mitch McConnell, importantly. But, I understand why the senator has said that. We certainly want to understand that, it may take a while. I know that this is a process that, we'll have to see what the outcome of the elections in Georgia are. We'll have to wait for the new administration to come in, certainly. I've had conversations with President-elect Biden, as have other governors, where President-elect Biden has committed that state and local funding is extraordinarily important to him and that he'll be working hard to get that done once he takes office.
Amanda Vinicky at WTTW. The latest census figures show that despite Illinois' relatively high turnout and enumeration efforts, the state again lost population. To what do you attribute the decline? Do you fear Illinois could lose not 1 but 2 congressional seats? And if so, what would that mean for the state? What steps is your administration taking to attract businesses and individuals to the state or keep residents from leaving?
Well, that is a long, complicated set of questions and answers to go with them. But let me begin by saying that this is, unfortunately, Illinois has been losing population for, I think, 7 of the last 10 years. And for, most of that, under Governor Bruce Rauner, was I think people had lost faith in state government. They had lost faith in things getting done in Illinois. And we've been working very hard to reverse that image for Illinois. As you know, we did a significant number of things in my first year in office, including preparing for investing in tourism campaigns and other things that will bring business and people demand to Illinois. I, of course, have been working with my Department of Commerce and Economic Opportunity to attract businesses. I'm on the phone regularly with large, medium, and small-sized businesses that are thinking about moving to Illinois to market the state to them and tell them why it's so important that we, should be home to their employees and their businesses. The biggest thing we have to offer in Illinois is a highly trained workforce. That I hear that over and over and over again, honestly. And I just heard it again from the Ferrera Candy Company that is expanding more jobs in Bloomington. And they evaluated other places that they could go and really decided that it's our investment in our workforce and the fact that we educate people here and prepare them for jobs that is the most attractive thing about our state. And I'm very proud of that. I think the people of Illinois should be proud of that. We have many more things that go, in the plus column for Illinois, and I try to highlight those things. But we'll continue to work on it. I think, you can't turn this around in a short period of time. It takes time to turn a battleship or a aircraft carrier in the right direction, and we've been doing that for the last 2 years, and I'll continue to do that.
Chris Ty at CBS2. Illinois residents are receiving letters from IDES containing the full names and social security numbers of fellow Illinoisans. What is being done to stop this, and can you promise it won't happen again? And why are full social security numbers being sent under any circumstance?
So a stop has been put to those right now as they're trying to manage the incoming fraud, as frankly most states in the United States are right now. I think I've talked about this a number of times, but identities have been stolen through mass national hacks that have occurred of Experian and Target and lots of places that have people's personal information, and then they're using them in this pandemic in a variety of ways, but one of them is in an unemployment system. So we're working really hard to deal with that, partnering with the FBI, of course, to address the fraud. One of the reasons that there's a letter that goes out to people is that a business actually, as you know, the unemployment system is a partnership between labor and business. Decisions are made about the unemployment system together in working group. And business really wanted to make sure that those letters would be sent to people. Having said that, I mean, there was, before this massive fraud that's occurred, that was not a problem. Now we've put a halt to it, and we're working with federal authorities to try to track down the source of it and also deal with any existing fraud that may have gone through. But I just want to remind you that there's 10 months now of not only a pandemic that's caused massive unemployment claims, but also the imposition of these hackers and fraudsters into the system, seeing that there's an overwhelming issue for unemployment systems across the country. They're trying to take advantage of that.
This is for Dr. Ezike from Hannah. Dr. Ezike, yesterday you mentioned that some long-term care facilities didn't qualify for the CVS Walgreens vaccine distribution program. Can you elaborate on why they didn't qualify and what the state will have to do to vaccinate those facilities?
I think the takeaway point is that all of our long-term care facilities are 1A. They're the highest priority group, and all of those facilities will get their vaccinations at the beginning right now in the coming weeks. The decisions by the Pharmacy Partnership Program were theirs to make, and sometimes there were some minor qualifications that they looked for that maybe a facility didn't meet, but the point is that they are 1A regardless. And so whether the vaccination is done by a pharmacy partner, CVS or Walgreens, whether it's done by a different pharmacy, whether it's done by the local health department, whether it's done by a strike team that goes in, all of those facilities will be done at the top of this order and will be done before we move on to these other phases that follow.
Ben Bradley at WGN. IDPH regional metrics show regions 1, 6, and 7 are all in the green. When is the earliest you will consider lifting restrictions on things like indoor dining in those areas? And if your answer is still not until sometime in January, why not sooner?
Well, Ben, thanks for the question. And the fact is that, like I said earlier, what we don't want to do is yo-yo back and forth between Tier 3, Tier 2, and that would not open bars and restaurants either way. We do want to get everything open as soon as possible. We are heading, generally speaking, in the right direction, although I have seen over the last, I think everybody has seen over the last couple of days that hospitalizations, which had gone down further than they are now, have now crept back up again, by more than 100 in the last couple of days, and that's concerning. So, we're going to keep a very close eye on it. I'm the first one to want to move the regions down to Tier 2 and Tier 1 and back to Phase 4 as soon as possible. But we also want to make sure that we've crushed this, growing number of cases and growing number of hospitalizations, and that we do not have, as we do now, a very, very large number of ICU patients. That number has come down, but it's still only down about 200 from its peak, a little more than 200. So I'd like to see that come down a little bit more, but we'll get there, I believe, shortly, and we want to see how the Christmas and New Year's holiday go.
Marty Pike at the Daily Herald. How will the general population know when it's their turn to get a vaccine?
Well, as we've seen, ACIP is coming out with its recommendations as needed. You know, we're far ahead of the general public seeing, its phase come. We're still in 1A. There's still, we haven't got to 1B and 1C, which will be weeks and weeks from now. And then, phase 2, 3, and 4. So, I would just say that patience is the watchword. And we're going to see over the next couple of months recommendations coming out from ACIP and worked on in the state of Illinois and across the country to deliver vaccines to everybody. But we certainly are very hopeful that we'll get to the general population sooner rather than later.
All right, Aaron Geiger at the Hyde Park Herald will be our last one today. We'll start with Dr. Zike, and then Governor, if you have anything to add, you can do that. He's asking in general about our state preparedness regarding the new strain in the United Kingdom. Are we monitoring passengers? Are we talking to the British consulate? What are we doing nationally to find out more about this? Do we do viral surveillance? And anything we know about this new strain? So Dr. Zike, you can go first.
Yeah, that's great. So yes, we've heard the reports about the UK strain, the variants, if you will. We have reached out. We've talked to the public health officials in London. We've talked to the CDC, who's obviously working with the World Health Organization. So right now, what we know is that there is a variant that has been circulating. There's question of whether this has caused, if it has increased transmissibility. We are aware that there have been some tightened restrictions around the UK and travel in Europe. We have been advised that the measures that we're taking in terms of masking and promoting these mitigations are the same precautions that would need to be taken for this variant. We do have surveillance in the state. We send a set number of samples to the feds every single month. We've been told that we're going to increase the amount of specimens that will be sent come just next week in January. We're going to increase that so that we can continue to have a more robust surveillance to see what variants that we have circulating here. But we have been told that there is no need to change what we're doing. They are talking at the national level in terms of what steps there may be for travel into the United States generally, in terms of whether it's testing before, et cetera. And so we'll be looking to our federal partners to see what those guidelines may look like. But we need to continue the things that we've been talking about for the entire year: to wear the mask, minimize the gatherings. It's still spread the same way. We don't have any information that suggests that this vaccine would not be efficacious in preventing for this variant. We have not received any information that our testing would not be able to detect this new variant. So we're continuing the course as of now, and we'll continue to update you as more information becomes available on this variant. And you may have also heard about the South African variant that we're hearing some news about.
All right. Thank you, everyone. And we will see you the next time we have an update. Have a good holiday.